Members of the public and media friends, good afternoon. I now report the new cases reported on the 21st of April yesterday. Yesterday, through PCR, we have confirmed 290 cases. Among them, 74 cases were confirmed by the HA, 54 were confirmed by the CHP and the Public Services Laboratory. The remaining 162 cases were confirmed by private laboratories. On the other hand, through RAT, we have confirmed 284 positive cases yesterday, which were reported on our platform and were confirmed. Yesterday, the total number was 574 positive cases in Hong Kong. So far, in the fifth wave, Hong Kong has recorded 1.18 million 8,277 cases, including 4,176 PCR cases, as well as 244,101 RAT positive cases. Among the cases confirmed yesterday, 11 were imported. The remaining 563 cases were locally infected. Among the imported cases, 7 were caught at the temporary specimen center at the airport, including 4 cases arrived at Hong Kong on the 20th of April on CS110 from Australia. The other 3 cases were from Canada, the UK, and Mexico. The other 3, or rather 4 imported cases include 3 caught during hotel quarantine, including 1 identified through PCR on the 5th day and 2 identified on the 2nd day via RAT. The 3 cases were from Korea, the US, and France. The last case was caught in the community isolation center on the 12th day from Indonesia. In terms of genome sequencing, yesterday the Public Services Laboratory performed 176 samples. We have found no L452R positive cases. 173 cases tested negative on L452R. The remaining 3 samples were unconfirmed because of a low viral load. For care homes, we haven't reported any new cases from care homes with previous infection. Yesterday, 5 residential care homes for the elderly people have reported 6 new cases who are residents, and 2 residential care homes for people with disability reported with infection, reported 5 new cases who are residents. For schools, today 299 schools have resumed in-person classes, including 67 on the Hong Kong Island, 112 in Kowloon, and 120 in the New Territories. More than 160,000 students as well as staff have returned to school. The 299 schools have reported to us the RAT results of teachers and students. 1 student reported RAT positive from 1 school. In terms of death, so far in the 5th wave, Hong Kong has reported 9,014 deaths, an additional 15 compared with yesterday. The mortality rate is 0.76%. For those above age 80, the mortality rate is 10.425. That's all for my report. Dr. Ho, please tell us about the hospital authority situation. Good afternoon. So far, 2,382 confirmed patients are receiving treatments in our public hospitals and North Lantau Infection Control Center and the AWE Infection Community Treatment Center, as well as the CHP's Infection Control Center. Yesterday, we reported 2 critical patients, 6 serious patients, and 19 critical patients in ICU, and also 15 patients have passed away, including a 93-year-old female patient who passed away on the 20th of April. 14 patients passed away in the previous 24 hours, including 8 males and 6 females aged between 75 and 103. Among the patients who passed away yesterday, all of them were of an advanced age, above 65. 3 were from care homes. 4 did not have any vaccination. 7 had 1 dose. 2 has 2 doses, and 1 had 3 doses. On the previous day, 337 patients have recovered. 244 patients were discharged, and 1 patient was found to be positive on admission to hospital. 5 patients in the same ward were classified as close contacts. For staff, 22,183 staff have reported infection. 21,610 staff members have returned to their positions. Thank you. Now we will take questions. Please tell us your media organization before you ask questions. The lady on the left. I'm from Cable News. Now the Indonesian who tested positive on the 12th day, is that a foreign domestic helper? Has he or she been to the employer's household and any infection in the household? Now there are reports that the government would relax the circuit breaker system from 3 to 5. Does the CHP know if that is feasible given our current situation? Some legislative council members suggest setting the threshold at 5% of the capacity of the airline. Is that feasible? So since the 1st of April, how many airlines have invoked the threshold of circuit breaker system? And after the lift of the flight bans for the 9 countries, that we have a lot more imported cases. Relaxing the air ban cause more risk, and we will bring in variant strains into Hong Kong. Now about DSE, how many students have been sent to the Penny's Bay? How many confirmed cases and close contacts, or for other reasons? And has anyone been sent to Penny's Bay during the course of examination? 3 questions. Among the confirmed cases today, there is a case which tested positive on the 12th day. That is a 38-year-old female, a foreign domestic helper. She had no symptoms. On the 8th of April, she arrived in Hong Kong on CX798. Upon arrival, she was required to undergo 7 days hotel quarantine. She had a test every day. After the quarantine period, she was still negative and she returned home. According to the requirements, on the 19th day, or the 12th day, that is the 19th of April, she left a sample at the community testing center. The result was unconfirmative by a private laboratory, and then the CHP tested positive of the sample. That is with a high CT value, 35. She had no symptoms, and the employer's household had no symptoms as well. They are close contacts, however. We believe that to be a re-positive case. The public service laboratory will perform genome sequencing and analysis for the case. About the circuit breaker system, the FHB is performing a risk assessment exercise concerning the global epidemic situation and infection number, as well as details of the imported cases. I believe that the FHB will make an announcement soon. I don't have any detail right now.
The third question was about DSE exam students, and the Education Bureau had announced that if students are tested positive, they can choose to check into Penny's Bay for quarantine, and they can take the exams in Penny's Bay. For family close contacts, they can also choose to be quarantined in Penny's Bay. As far as I know, there are some 20+ candidates who have checked in, but you need to ask for the exact figures with the Education Bureau. Hong Kong 01. We see that there are 3 deceased people who had taken 2 jabs. So what is the age distribution? Do they have any chronic diseases? The second question is the QR code for recovered patients. Now, even when they receive the QR code, some people say that they were not successful using Leave Home Safe when entering restaurants. Are there any other factors at play? When can a recovered patient use the QR code to enter these premises? Are there any figures indicating members of public who have applied for quarantine documents? How many successful applicants have there been? Let me respond to the recovered patient QR code question, and my colleague can respond to the the disease cases. On 14th of April, the government allowed different electronic platforms, including the vaccination platform, e-health, and if a recovered person can use their ID number, the issue date, and their recovery date, and receive a QR code. This QR code, they can use it as a permit. It would be valid for 180 days since their recovery and enter premises. If they can download it successfully, then they can include it on their mobile phone, Leave Home Safe app. So why do some members of the public, why aren't they able to scan the code? These might be technical issues, and I don't have any information on hand. Reissuing the recovered proof of recovery. Previously, for all PCR positive cases, we had issued 2019 COVID recovery document, and through the RAT declaration platform, if their application is successful, then they will receive an SMS quarantine message. So when they make an application and run into difficulties, they can provide their information, and we will verify their case, and once it's confirmed, we can reissue the proof documents. Regarding the elderly person who deceased yesterday, one of them received 3 jabs, and that is a male patient, 78 years old, and he had a lot of chronic diseases, hypertension, high cholesterol, and also coronary heart disease. Another person who received 2 jabs also had coronary heart disease, pneumonia, hypertension, and also kidney problems. Next question. So, respiratory expert Dr. Liang Zicao said that the government needs to conduct more work on tracking, especially in schools and designated venues, so they can stop the transmission as soon as possible. So I want to ask the health department, have you any plans for resuming the tracing of patients? I'll respond in Cantonese. Thank you for the question. The government announced yesterday that they would relax the social distancing requirements. So when it's relaxed, there's a possibility that there would be an uptick in cases. So we'll keep a close eye on the following week or 2, whether the number of cases will increase. For example, for dining establishments, when they are relaxed, will more members of the public have meals in restaurants, and when they remove their masks, there's a higher risk of transmission. We will keep an eye on the situation, whether the number of cases go up. Now, our current tracking is focused on family close contacts and home quarantine cases. If necessary, cases will be transferred to community quarantine centers. Family contacts, they can be quarantined at home. We have 2 electronic platforms to collect infected persons' information, including their residential address, their work address, building name, and so on. So when we collect this information, we will conduct analysis. If we could discover that some work venues or residential buildings have a high number of cases, then we might have to issue a mandatory testing notice and discover hidden cases. So if we receive these through the platforms, we will, the electronic platforms, we will follow up these people and conduct some risk control measures. So when feasible, we will conduct further epidemiological analysis and follow and track cases to see whether there's an outburst. So currently we are focused on dealing with outbreaks, for example, in elderly homes or schools. If there is outbreak or an increase in cases, we will focus our efforts in these areas and conduct tracing. Next question. Ming Pao, first of all, you referred to the positive case detected on the 12th day. So preliminary information indicates that there's a reinfected case. So the employer and family have no symptoms. So can you confirm that the whole family was tested negative? And previously, there were also cases detected on the 12th day of quarantine. So these positive cases detected on the 12th day, what is the DNA analysis? Did they infect family members or close contacts? And the previous two cases, can you confirm it's a reinfected case? Just now you said you will monitor the situation regarding the flight ban. So if we relax the flight bans, will that increase the risk of imported cases? There are some patients who will test positive after a certain period of time. So how will you assess that risk? I want to know some DSE candidates. They had symptoms last night and they had to be treated in hospital. They had to stay in a hospital. So did HA receive these cases where DSE candidates were tested positive and had to stay in hospital? I want to know what is their current condition. And lastly, regarding the tracing, in recent days, the infected cases have remained stable. So does the CHP have a plan or a rule when you will reconsider the tracing of infected cases? Thank you for the question. The first question was about the 12th day, that one imported case who tested positive on the 12th day. This patient, previously they did not have a positive record, but they had no symptoms. They had received 2 jabs, and at the quarantine hotel, all the tests were negative. But on the 12th day, they tested positive. The CT value was 35.7. So we will arrange for this patient to be quarantined in the community. So their employer and their family don't have symptoms, but they will be listed as close contacts. They'll need to be tested, and we will also deliver the care package to that family. So looking at this case, currently it seems that it's a reinfected case. So during hotel quarantine at the same floor, there were no other cases.
It's very unlikely that she was infected in the hotel. For previous cases which were caught in the community on the 12th day, we performed investigation and tracing for those cases. The point is to find out if any imported cases entered the community. Some cases have tested positive overseas, so they should be repositive cases. For other cases with low viral load and high CD value, they are probably repositive cases as well. Now we have performed a genome sequencing for some 12-day cases. Initially, the initial result is they are Omicron variants, so it should be related to imported cases. In terms of the circuit breaker mechanism for airlines, it is a key measure to prevent against importation of cases. All travelers on arrival has to undergo test and hold at the airports to make sure that there won't be a leak. And also they have to make use of designated transports to undergo 7 days or 14-day quarantine in hotels. With full vaccination, they only need 7-day quarantine. However, they have to be tested every day. That will ensure that even if there are positive cases, they would be caught at the airport and the hotel. We perform genome sequencing for every imported case to find to look for unusual variants. In terms of the airline circuit breaker mechanism, there are many factors to consider. I believe the FHB would perform risk assessments. We would work with them to make a risk assessment and implement measures. About tracing, at present, the number of cases is still at a relatively high level. It is very difficult for us to gather epidemiological information for each and every case. However, we would reach out to the patients via our platform to collect information to identify possible outbreaks or spreading events in buildings and offices. Now we are focusing our efforts on care homes and schools. When there are cases in schools, we would be careful. We would look at the trend to see whether there are outbreaks in schools. When the number further climbed down, we would be able to perform more in-depth investigation to find out the source of the outbreak. Sorry, the speaker is not using the microphone. In our epidemiological investigation, we would ask the patients whether they had symptoms and whether they had been infected. So besides cases tested positive on the 12th day, some cases caught at the airport or hotel did have infection record overseas. So I believe that they are repositive cases. Yes, there are such cases. Previously, there were 5 cases. 2 are confirmed to have infection record overseas. We have announced the data before. Dr. Ho, I don't have the statistics concerning individual cases, but we will pay attention to the situation. Let's take an English question.
I'd like to follow a question from the South China Morning Post. So we would like to follow up on the DESE candidates at Penny's Bay. So can you tell us exactly what the figure is regarding students who went there to sit their exams? Are they all confirmed cases, or are they just close contacts? And also, we would like to follow up on the oral pills. So how many? Sorry. So how many private doctors have requested for the COVID-19 oral drugs from the health authorities? And also, can we ask how many flights in total have been suspended after April the 1st? Thank you.
Thank you for your question. For the first question about the DSE candidates, in this year, the government has made some arrangement for the DSE candidate who are confirmed cases or who are household contacts of confirmed cases to that examination in the penny space. So if any DSE candidates, they were tested positive, they can call the examination authority to make arrangement for them to be admitted to penny space for isolation so that they can take the examination in penny space. And also, secondly, there are some candidates who are household contacts of confirmed cases, so they could also be arranged to penny space quarantine sessions for them to be quarantined in penny space, and they can take the examinations there. I don't have the exact figure of the number of confirmed cases and household contacts who take examinations in penny space, so maybe you need to ask colleagues from the Education Bureau. For the second question on the antiviral drugs, the Department of Health previously has launched an electronic platform for private doctors who are interested or who need to prescribe antiviral drugs to their COVID-19 patients to register, and the government will deliver the antiviral drugs to them. So far, there are about 250 doctors registered through this online platform to obtain the antiviral drugs. For the third question on the flight suspensions, the figures shows that since the 1st of April, there are about 35 flights which requires suspensions.
下一題
30. About roughly.
Next question. Good afternoon, Hong Kong Economic Times. The confirmed students today, when did he last went to go to school, and were there any cases from that same school? Are we still adopting the criteria where 5% or to 10% of the school has been infected when they would be sent to, when other students would be sent to quarantine? Now, for doctors who registered for oral pills, is there an update? The private doctors list. So how is the discussion with the private sector, and when can you announce the list? Now we have an Indonesian foreign domestic helper tested positive on the 12th day after hotel quarantine. So do we need to extend the hotel quarantine period further? Thank you for your questions. The first question on schools. 299 schools have resumed in-person classes today. Only one case was reported. We have taken a look at the case. The student hasn't been to school since classes resumed, so it is unrelated to school. The design of the mechanism is to find out positive cases at school as soon as possible, as well as finding out cluster of cases. Every day, students have to take a RAT before going to school. The point is preventing cases to enter schools. We request schools for AM school, that is before 10 a.m., for PM school before 2 a.m. to report the RAT results of students on that day.
And we will look at the schools, how many teachers or students have been tested positive. Now, we mentioned 5% and 10% standard previously. and we will treat that as a guideline for a large outbreak. So we are not limited to that guideline for conducting epidemiological studies. We look at the daily statistics, and if a school submits a large number of cases, we will look into that and see whether it is concentrated in one class or dispersed over different classes. And in the community, we have hundreds of cases every day. Most importantly, we need to make sure that these cases have not returned to school, and when they are at school, we don't want to see gathering, and we don't want to see more positive cases arising out of gatherings or a concentration of cases in a certain class or group. When that occurs, we will contact the school and investigate and see whether we need to strengthen our measures. We mentioned previously that if the whole school has 5% of positive cases, then we might have to follow up, including whether we need to suspend the school and so on. Now, if individual classes have 10% of confirmed cases, this is not a hard and fast rule. We will conduct individual assessment for each case. Your second question was about close contacts. Currently, students have to wear a mask when they return to school. They need to have protective equipment. So if a student is tested positive, they should not go to school that day. But if they had returned to school, typically their classmates will not be listed as close contacts, but each individual case, they have to undergo home quarantine. The home relatives have to undergo home quarantine. We will have to look at whether there are any transmissions in the school and whether other people need testing and quarantine. Regarding private doctors, I had answered just now. There are roughly 250 private doctors registered on our platform. We are now verifying their information, the clinic information, and we are contacting them. So when the list is ready, we will disclose that on the web as soon as possible so the public can verify for themselves which private doctors can provide the oral medication. Your last question, could you repeat that? I had provided details just now. It seems to be a reinfected case. We will not define it as a community case because this reinfected case, this occurs quite frequently. So they had been infected previously, they did not conduct testing, and maybe after a certain period of time when they are reinfected, then you do the PCR tests, the CT value is high, but usually these are not highly transmissible cases. To be on the safe side, when we have a positive case, we will arrange for community quarantine. They will be observed and monitored. First of all, I see that there's a reduction of cases today, so how will CHP assess the development? Dr. Al mentioned a few days ago that there's no hard and fast rule for tightening social distancing measures. So in phase 2 of relaxing social distancing, is there any guideline? I have a question regarding DSE. So after the examination, if students discover they are positive, what measures are there for other students in the same exam venue? Will they be listed as close contacts? And I also want to ask HA, what is the appointment situation for the designated clinics? I know that they have set aside a quota for students. So how many students have used these designated quotas? Thank you for the question. Your first question about the trend. So today's figures compared to yesterday, it seems to have dropped a little bit, but it is still hovering around 500, 600 cases. Now, we monitor the daily situation. We see a slow decline and we're very happy to see that. We're now in a stable phase. The number of cases are getting smaller, but this figure is still at a high level, so the public need to be careful. We will keep a close eye on the trend. This week, we have kids returning to school, and we see the number of school cases is within our expectation. We don't see a large number of students testing positive, so this is a good sign. But starting from yesterday, when schools resumed, we also relaxed some social distancing. Now, that is of concern. We have some venues that are opening, and restaurants are also operating longer hours. So we'll have to wait a week or two to see how the relaxing of social distancing will affect number of cases. We might see an uptick in cases as we relax social distancing, but currently, if we maintain a stable rate, if there's no rebound, if there's a continued decline, the government will balance the different factors such as public health, the economy, the inconvenience to the public, and so on. We can relax social distancing in phases. But of course, when we move into the next phase, it will depend on the epidemiological situation. If there's a rebound, if there are a large number of positive cases, we need to have a plan in place. Regarding DSE candidates, typically the Education Bureau or Examination Authority advises that candidates should take a RAT before taking an exam. They also need to make a health declaration. So all this can help prevent positive cases going to the examination venue. Previously, CHP also provided some health guidelines. So the exam venues have sufficient prevention measures, and if there is a positive case, we can prevent transmission. So typically, even when a candidate after the examination is tested positive, the other candidates typically will not be listed as close contacts. Regarding the 23 designated clinics, every day we can provide more than 4,000 appointment quotas, and we set aside 50% for high-risk groups, including our primary school students. We also set aside a care hotline, and as of 19th of April, 1 o'clock, the 23 designated clinics under HA have already treated more than 116,000 visits, and 16,000 of these appointments were made through the care hotline. Okay, that concludes the press briefing. Thank you.